What made you want to be an optician?
Well, I started off with a degree in gourmet cooking, and the satisfaction I got from it in terms of being able to get an instant response in terms of whether the product and the service we rendered was good or bad, kind of filtered over into this profession that I'm in now. So I went back to school for it, and what I get out of it is the greatest benefit of being able to have people come in, put a pair of glasses on and contact lenses, and the response we get in terms of, oh wow, I really truly can see now.
How does healthcare affect your vision?
Healthcare affects your vision in a lot of ways. It affects your self-esteem, it affects your confidence, and it affects your overall health if you're having health issues. So as long as we've got all those things aligned in terms of good health eye care, our confidence level is up, our self-esteem in terms of being able to be very sure about what we're doing is up, so it makes for an all-around better person.
Why did you decide to pursue this career?
I always knew that I wanted to do something in healthcare. I started taking health occupation classes when I was in high school and became a certified nursing assistant and CPR instructor then. And nursing just is so broad. You can work with children or adolescents, or you can work with the elderly, and I just have a broad range, and I don't get tired of doing any one thing all day long. So that's really what drew me to the career.
Do you think it's important for youth to have regular health checks? If so, why?
I definitely think it's very important for youth to have health checks. Youth think that they're invincible, that nothing can happen to them, and that they're immune from all of the health problems that exist in the older population. So it's very important. It helps identify things such as high blood pressure, diabetes. It helps just go over education about good health topics that they should be doing, about immunizations that will protect them against diseases in the future. So health checks are extremely important. Just because you're not sick, have a cold, running a temperature, they still need to be seeing a doctor at least yearly.
You as a counselor, are there any health issues in the schools that you know about?
I would have to say probably obesity. I see a lot of kids are getting larger, and even though we do have PE, we only have the one segment that they take. So maybe if we could make the segments shorter and they have more PE time. They do have the free time when they have the little rec time after lunch, but the students really don't utilize that a lot as far as the walking. That's like they just kind of congregate together and talk and socialize. As far as the other issues that we talked about, I think some of the factors would be, as I said before, the nutrition. That would be something else. Here at the school, we're very good. We do provide nutritious meals for the students. I know before, a couple of years ago, we used to have the entrees like the fried chicken and so forth. But now that we've streamlined those things and looking at health issues, the cafeteria has really stepped up to the plate pretty much and providing nutritious meals for the students.
The journalists also talked with leaders in our community about their view for promoting better health in Greene County.
What is the business in Family and Children's Services?
Family and Children's Services is a government-funded agency that assists families with food stamps, Medicaid, and temporary assistance for needy families. They also provide adoption assistance and placement for children that are in unhealthy environments.
How do you feel when you see middle school students unhealthy?
If the health issues are not addressed now, they're going to experience some difficulty later on in life. And so that's what I think about. I think about them not being able to live a life that is fulfilling, a life that allows them to just be happy.
Do you think violent and abusive environments leads to being unhealthy for children?
Yes, definitely. Children need to be in healthy homes. They need to be in homes where they are safe. They need to be in homes where they are taken care of. They need to be in homes where they can have medical assistance, medical attention if they are sick. And being in abusive environments only leads a child to become angry, leads a child not to trust people. It leads to behavior problems, and it also can lead to physical sicknesses as well.
What can help our youth in Greene County the most?
What can help our students in Greene County the most? I would say the multiple recreation establishments, meaning students should be able to go bowling. Bowling is a good way for students to burn calories and exercise. There should be more basketball facilities. I would like to see a swimming pool whereby, our students can go to the community swimming pool in the summer times. I remember as a kid, we did a lot of swimming on a daily basis, Monday through Friday. We would pay 50 cents and we would go swimming. And so I would like to see some of those things put in place for our students.
By the end of the summer workshop, our young citizen journalists gained in their knowledge about health and reporting.
What do you think about training middle school schoolers as citizen journalism?
I think it's a wonderful opportunity. It's a wonderful opportunity for students to explore others' views. It's a wonderful opportunity for students to be able to report on those specific views. And also it provides the students the opportunity to just become aware of certain issues that are plaguing our communities.
We hope the seeds planted in this workshop will grow and contribute to greater awareness about health in the Greene County community.
How has your thinking changed as a result of being a health reporter?
I know more about health, and I know how to be more professional when you want to interview somebody.